good morning, good afternoon, and good evening, everyone. And welcome to this exciting webinar. My name is Firmaye. I am delighted to be your moderator for today's session. So this webinar is part of a broader effort to foster evidence in foreign policy making in Africa, where we will be reflecting on the successfully concluded entry-level evidence to policy training for our inaugural cohort. So our objective is going to be simply to learn from our pioneer participants or the cohort and to celebrate their achievements and discuss how programs like this can bridge the gap between research and policy. So whether you are a researcher, a policymaker, or development partner, or simply an enthusiast of evidence-informed decision-making, this session is exactly for you. So we'll dive in. And to start us off, I would like to invite Dr. Ismail from ACRES, or the Center for Rapid Evidence Synthesis, to give us a quick introduction to the E2P program. Over to you, Doctor.
Great. Thanks, Firmaye, for the introduction. And welcome, everyone. Briefly, I'll talk about the program and the motivations that we had for it. So thinking about a knowledge broker in Africa, or specifically thinking about how we translate research evidence and other forms of evidence to policy requires a specific and unique skill group of people who need to be skilled in this. And over the years, a niche has been created for this group of people who go by several names as knowledge brokers or evidence intermediaries, with a core purpose of, one, ensuring that research and other forms of evidence are taken up by the policymakers, and these investments are not wasted or do not go to waste when it comes to the work that has been put in. So at ACRES, or Center for Rapid Evidence Synthesis here in Uganda, we're a knowledge brokering institute. So we've been in the space of supporting policymakers to get evidence in a timely manner, working with them, building relationships with them, and understanding their needs for evidence at different points, and ensuring that the evidence that we provide is relevant and appropriate to the needs that they do request on us from time to time. And over time, we've had lessons as we've had opportunities to train various teams across the world, but mainly in Africa and other low and middle income countries, where we've trained several teams in rapid response training. And through these, we've gained insight and work to understand what competencies, and here I'm referring to the knowledge, skills, and attitudes of a knowledge broker. So following those efforts and work that we then undertook to understand what are these knowledge, skills, and abilities, capabilities of a knowledge broker, through reviews and several interviews in a research that we did, we identified 3 core competencies that we are now looking at as a core benchmark or core framework for which we do expect a knowledge broker to have the abilities to engage with policymakers and be able to support them to, one, to be able to access evidence in a timely manner, but also be able to use. So we do look at, and these competences are now embedded within this program that we're talking about, that we are going to talk about today. One is the core technical competences, and here we have several competences that we all know of or we have been tuned to be able to translate evidence to policy, evidence synthesis, understanding public systems and how policies are made and the pathways for that. Having the language for research and understanding, being able to interpret that, and being able to critically think about the policy needs, the needs of the policymaker, and how these intersect or what is relevant and appropriate for them. But also, critically, you need to be able to write and package this evidence, and also need to be able to mobilize resources. Beyond that, there are other skills and knowledge and attitudes that we do, that we've learned over time that are required, and what we're calling cultural competences and collaborative competences. The skills to be able to build relationships, to be able to facilitate the use and uptake of the evidence in different spaces, and also to understand the differences in the cultures. And here cultures, you think about cultures within a country of a culture of a policymaker, in how they would anticipate what you're writing and the language that you're using, but also cultures of how policymakers generally interact with each other, to be able to understand that, to be able to appreciate the values, the politics and the science and the diplomacy and the citizenship in that. So we have built we have developed we've designed a program that encompasses all these different skills and attitudes in different activities that we have put together. And for someone to be able to gain these skills, we've also shown that, or we've also learned that they don't come once off. They're built over time. So this the competences you develop in your first year as supporting policymakers or translating the evidence will grow, and they need to grow to be able for you to develop into a proficient knowledge broker, but also later on, and hopefully as you continue growing in the field and contributing, you'll be able to develop into a leader. Hit the next slide, please. So what are the opportunities that we looked at? One, in developing this program, we looked at several or three key opportunities that we hope our trainees will be able to get. One, we're looking at developing their relational skills. And this is also this also is in tandem or aligned to the technical competences that we're looking at. So we intentionally or we deliberately pair policymakers and researchers, so that they're able to understand or they're able to communicate, network, build, understand the different cultures and languages, but also build the relationships within and be able to be relevant to them right from the beginning. This creates opportunities for networking and also deliberately having modules in cultural dynamics and collaborative skills. Next slide. What else do we offer in this skill in this program? One is the real world practice, and here I'm referring to going beyond what would be a teaching setting where you sit in a lecture and you're taught what you need to do. You're taught how evidence synthesis needs to be done. You actually will be taught how these trainees are taught how evidence synthesis is done, but also given the opportunities to actually synthesize the evidence and work with policymakers through. So providing space and time for a self-paced, for one to be able to do the work and learn within a specified time period. And for this, we've defined quite a longer time period according to what we would look at for those in practice. We used to have workshops, usually 5 days or 3 days, or even sometimes 2 weeks workshops. But quite often we learned that this is not enough. And right now we have a program. We have a program that helps someone go through that process with also mentorship along the way and having a tailored support. So for example, the entry-level program from which we will hear from the trainees is a 15-week program. We also have one that targets those at mid-level who have gained a sufficient amount of skills, and this is going to be a 26-week training program. And those that are advanced, that are looking at going beyond being proficient and getting expertise, but also developing into leaders. And this is also going to be a 26 training program that looks at the advanced stages or to look at the expertise stages for knowledge brokering, but also adding the leadership component. The second part about the reward practice, that you work on real policy issues. We're going to hear stories of examples of those. For example, the team that worked with a policymaker in Ethiopia in understanding in understanding how women should be represented within the policy spaces and what are the recommendations to that. Then also I've already highlighted the holistic approach to training and being able to engage with employers. So key part of our program is that we work with partners who are already in the space of translating research to evidence and supporting policymakers, and working with them to build their capacity through their employees at the different levels. So there is engagement with the employers to be able to provide this support. Next slide. Next slide, Peter. So what is it that I'm talking about finally? Where we're talking about advances in evidence-informed decision-making. So as I highlighted, we look at someone, we are looking at an individual to grow from the time they start doing probably their first evidence synthesis, let it be a rapid review or systematic review. And through the years, how have they grown in terms of their attitudes, in terms of their skills and proficiency to be able to do this? So we do have these levels, and as these I have mentioned, and throughout these levels, we'll be looking at the different skills and competences and what we do expect individuals to learn all the way. And today, this afternoon, we're going to hear from a group of our cohort of 2024-2025 who joined us for the entry-level program. And these were 19, including 5 policymakers from the different countries, from the 4 different countries, Malawi, Uganda, Tanzania, and Ethiopia, and also researchers from those countries. And from these, we have, they'll also talk about the products that they have developed to support real policy issues. And hopefully this will raise an interest in how we train knowledge brokers, and also how we develop this field in Africa. Thank you.
Thank you, Dr. Ismail. That was very insightful, and I'm sure people are going to be interested in this program. As you've explained, this is something that's going to continue and adds on the different phases. And I encourage everyone to put your questions or ideas or interests into the Q&A box if you have any ideas in there. So saying this, as has been indicated, we have with us today 5 of our pioneers and participants of the first entry-level E2P training. and we'll be hearing their experiences and reflection in a bit. But before we start, let me give you a little bit of their background. So first, we have Shimwe Ngeze from Tanzania, who is an emerging leader in the evidence policy ecosystem and is a dedicated research scientist at the Center for Reforms, Innovation, Health Policies, and Implementation Research in Dodoma, Tanzania. So welcome, Shimwe. Then we have Nebiyou with us from Ethiopia. He's one of our policymakers in the training, and he's a trained professional in applied psychology and public management, and has more than 15 years of work experience, and is currently working in the Ministry of Women and Social Affairs in different positions, and currently serving as the head of Gender and Social Affairs, Inclusion, Monitoring, Evaluation, Ensuring Accountability Department. Then we have Acana from Uganda, who is a dedicated economist and research associate at the Center for Rapid Evidence Synthesis in Uganda, and is an emerging leader in EIP space, and aspiring to drive transformative change in public policy. So welcome again. And then we have Sifiso from Malawi, who is a trained medical laboratory scientist and an emerging research scientist in the health system and policy. And she aspires to become an international health policy analyst, leveraging evidence to bridge the gap between research and practice. And last but not least, we have Dr. Hussein Athumani with us from Tanzania, who is a principal dental surgeon and public health specialist with over 15 years of experience. And he is an exceptional, dedicated to improving healthcare system in the country, and now currently heading the health system strengthening unit at the Ministry of Health in Tanzania. So we will be hearing from each of our pioneers and panelists today about their experience. And so as you can see, this is an exciting combination of professionals. And again, I want to remind our participants to put their questions in the Q&A chat box. So without further ado, over to you, Shimwe.
Good evening, everybody. My name is Shimwe. I am a research scientist from Dodoma, Tanzania. And I'm here to share with you my experiences and insights from the Pioneer Entry-Level Cohort of the Evidence to Policy Training Program, which I am a recent graduate. Next slide, please. So basically, what motivated me to join this space was my deep curiosity for how research findings translate into real-world decision-making. And having been in research and playing around with research for the past 2 years, I was basically based on either qualitative or quantitative research. And having that you have done the qualitative or the quantitative research and you have gathered the data, what happens next? You know, and so I yearned to bridge the gap between knowledge production and policy implementation, because for all of the researchers out there, you know that when you're writing a research report, you'll have a recommendation section where you would recommend the government, you will recommend stakeholders, where you would recommend NGOs. But to what extent is this data actually being used? And these inquiries raised my curiosity for how we can bridge the gap between knowledge production and knowledge translation. And this training provided the perfect opportunity for me to gain practical skills in applying research evidence to policy context, which to me is a crucial step in making research work more impactful. Next slide, please. Yes, and the training program was 15 weeks long, and these 15 weeks have had a really extensive impact in the way that I work and in the way that I conduct my research right now. And first and foremost, it has boosted my skills in a lot of different areas, including navigation of online databases. There is a sea of information out there, whether it's on Google Scholar or PubMed or EBSCOhost, there is plethoras of information out there. So how do you pinpoint one specific thing from this sea of information? And this program has given me the skills to navigate and how to look for the needle in the haystack, if I can say. And it has enabled me to be able to conduct effective data extraction of policy relevant data. Secondly, it has reshaped my approach to research. I'm no longer thinking of qualitative, quantitative. No, I'm also looking at what is the evidence that is inside this? What is the evidence that is in this document? What information from this document can help me to answer a policy question for a certain organization or for a certain government decision-making institution. And in Tanzania, in the sector of health, we have got the Ministry of Health, and we have got the implementing body, which is President's Office, Regional Administration, and Local Government. So if they come to me with a question, and I have so many documents that I can read from, what are the questions that I'm supposed to ask the stakeholders? And what are the recommendations can I give the stakeholders to answer the question that they have brought for me? So through this program, it has reshaped the way I view research and has reshaped the way I forward my questions with the stakeholders who approach me. And thirdly, it has boosted my confidence. For young professionals dealing with stakeholders or decision makers who have years and years of experience in or positions in the Ministry of Health or at the PREG or international stakeholders, it's really scary at times, and you might not know like how to approach this person or how to structure your questions. But through this training, I have gained the confidence that I need, and I've gained the willpower, I can say, to confidently stand and voice out an issue or point out an issue or recommend something for these different ministries. And last but not least, this training program has enabled me to be able to network and to meet different people. I have been able to work with esteemed researchers from all across Africa, Ethiopia, Malawi, Uganda, and we have had trainers and tutors from the UK, from West Africa. I mean, it was a really nice space for me to just collaborate with so many skilled and gifted people. And all I can say is a big shout out to Acres, a big shout out to all of the stakeholders and the funders who brought this to us, because it's something that in Tanzania is new, and it's an area that has not been explored before. So this was something that was that has come at its perfect moment, and I'm really grateful for that. And that is the end. Thank you so much. Asanteni sana.
Thank you, Shimwe. That was a great reflection and a really great start at a high note. So saying this, I think we'll go next to Nebiyou from Ethiopia.
Okay, thank you, Firmaye. I'm Nebiyou from Ethiopia, and I'm a policymaker. What I'm going to present within the given minutes is the main motivation which gives me to attend this training, and what are the causes, skills, knowledge, and experiences that are gained from this evidence to policy training program, which is arranged by SA. So, on the next slide. When this is a motivation which gives me to join this evidence to policy training program, the first and the main one is it is highly linked with my daily professional work. As I have seen from my bio, I'm working for Ministry of Human and Social Affairs, it is a highly responsible organization to work for the protection of the rights of most vulnerable segments of the population, specifically the rights of women, the rights of children, disabled, elderly, and other vulnerable segments of the population. So this organization required to develop and review different policy documents, strategies, and other legal documents. So in order to prepare or review these all documents, we need to protect the rights of this vulnerable segment of the population. Evidence has huge power. Without evidence, everything will be figure on the paper. So evidence has a big power for my organization. Due to that, I motivate to attend this training. And also there is a huge organizational gap on the knowledge and experiences of effective evidence generation. Due to that, I found that this training will be very helpful for my professional work as well as for my organization. Plus that, as a policy maker, personally, I had a very limited exposure to get such intensive practical training programs related to evidence generation. So it will be also one of the motivation factor for me. So I thought that it will contribute to put my impactful contribution for my organization, for my country, as well as for the target populations for whom I'm working. So due to that, the another motivation factor is it creates, I found that, I believe that the training program will create an opportunity for me to get different researchers and policymakers from different countries to have different experiences, including cultural difference. So, and the last one is I think that this training program is helpful for the successful and impactful career development in the policy making future work. So these are some of the motivation factors that give me to attend this university policy training program. Here's the next slide. So after attending this training for about 15 weeks, I have got a lot of additional knowledge, skills, and attitude toward this the needs of evidence for policy making and decision making. So, in detail, it gives me an insight to increase my knowledge, skills, and to shape my traditional attitude on the powers of evidence. More specifically, for the training, I have got knowledge or the identification of real problems with the country, real policy questions as well, and how to solve the identified problem from different contexts related, and how to make this problem to be understood by others, including researchers. So how to solve this identified problem is also has skills. Another one is how to develop problem and solution based goals, identified policy questions as well, problems, and some of the tools and techniques which is to generate evidences for the policy making or the decision making process. This is also another intake for me from the training, and how to cite these effective evidences is also another update that I have got from this training program. While we are trying to search different evidences from different search engines, we may have found a lot of researches or studies, but how to clearly identify the most effective evidences from this search engine. It means the inclusion and exclusion criteria for the effective search engine also. Another input is that I get from this training, how to screening, how to citation, and the use of different analysis tools in the evidence generating program is also another intake for me. But the very critical lesson that I have got from this training program is the practical project that we are working together with researchers. This is very practical knowledge for me. After we identified existing problem, we try to generate most effective solutions or recommendations or evidences from different search engines. This project gives me a very big and huge insight for me to work with different researchers as a policy maker, I think. I hope this is all on my side. Over to Firmaye. Thank you.
Yes, thank you very much, Nebiyou. That was, again, a very insightful experience, and also encouraging to see the practical importance of the program as well. And saying this, I would love to again encourage everyone to put your questions or ideas in the Q&A box. And now we will go to Joel for his reflection. Over to you, Joel.
Okay, thank you very much. Can you hear me? Yes, okay,
yes.
Good. All right, thank you, Firmaye, and have a good afternoon to each and every one of you here. Thank you for joining us today. My name is Joel Acana, and I work as a research associate and economist at the African Center for Rapid Evidence Synthesis. And just like the previous presenters, I'm really just going to talk about my experiences and some of the things that I learned and how from the program and how it is so far helping me in my work and my future aspirations. So moving on swiftly, I will start out with my motivation to join the program. My academic background is in economics, and economics in simple terms is really just trying to allocate resources in an optimum manner, kind of having to see that the limited resources in society are actually used in an efficient manner, really. And that is really the gist of evidence-informed decision making, trying to see that policies and decisions that are made are based on evidence, on information that is well researched and well contextualized, and so that we can be able to yield effective outcomes. And so having that background kind of just gave me an intriguing interest in the program, and so I was really excited to be part of it. But also, prior to joining the African Center for Rapid Evidence Synthesis, EPHI, I did some work at the Parliament of Uganda, and just listening into some of those conversations in some of the committees I was able to sit on. You realize that the discussions would be different if only some of this information could be translated. Some of these policies could be informed by well thought out processes, and in this case, it's evidence. So, yeah, it's really that kind of like gave me a very big interest in trying to understand and getting into the space of evidence-informed decision making, but also opportunity to grow professionally. As I said, I'm a young economist starting out, but this really sets me apart because how many economists are out there that can actually be able to do some of the work that I'm already doing right now under ECAD. So this opportunity to learn this approach to decision making and policy development, it kind of gave me this inspiration to take on this this opportunity and take on the program as well. But also, just as mentioned earlier, my new role at ECHI being that our work primarily revolves around evidence-informed decision making. It really kind of was a necessity for me because joining in, you need to understand what the work is and how it's done, and so this was indeed a stitch in time. But also looking at the structure of the program, having many different professionals as well as different countries and different cultural backgrounds and different, because when the more you interact with people from different places, the more you get different perspectives. You understand, okay, how do you solve a problem? How do you go about work? What is, what is new? What do you guys do different from us? So in a nutshell, all of these factors kind of just made me have a major interest in joining the program as well. Looking at some of the skills and experiences that I was able to gain, the program was very well structured in a holistic manner, and so we had the technical sessions where we learned different processes. For instance, I just outlined a few, but there are many other more that we actually were able to do. For instance, I just talked about conducting a rapid review. What are the steps? Yeah, how do you start all the way from question clarification to developing a search strategy? To conducting a simple search, and all of that. So all the way to analysis and synthesizing and developing a brief so that you can present to the policymaker. So some of these technical skills were really one of the major things that I was able to get out in the technical side. And then also, just briefly, stakeholder mapping as well. We had some good discussions on that. Policy communication styles, scientific writing, talk about the IMRAD style of writing. Yeah, so it's very many, it was a buffet, if I might say. Yeah, so, and then we also had the practical session. For instance, we developed, under my team, I was in the Ethiopian team, and I'm actually lucky that my policy maker is the one that just spoke before me. So I feel very encouraged, just listening to him and how he's really appreciative, especially of the work we did with him, and we're just basically looking at what are these effective, what strategies can be adopted to improve women participation in leadership and decision-making positions in Ethiopia, and seeing that our policymaker is actually heading a department in the Ministry of Women and Social Affairs. It really gave me a very good inspiration. It was a very good way to start. But also we had in-session activities when we were learning some of the technical stuff. We were able to just get some of the tutors will just go through step by step. Okay, how do you develop, for instance, a sample? We did a sample project in EPHI Reviewer, and seeing that now in my work, we actually doing a project now. We're doing an evidence gap map, but also still using EPHI Reviewer. So you see that some of these skills were actually very necessary. But also looking at the soft skills, we had opportunity to present our work, and this kind of gave us opportunities to be very efficient and effective in how to discuss and how to critique other people's work, and just standing up and listening to someone, and then someone asks you a question, and then you just take very quick note of that, and then think through it, and then you with your team respond. So it was really a very good back and forth, but one that really inspires you to get better at what you're doing. But also I was able to have some networking skills. I got some friends from Ethiopia. I see some of them here, and learned a few Ethiopian words, Amharic. That is part of the package, but operating in this space, what I've come to learn from the little time I've so far spent here in evidence-informed decision-making spaces, you really cannot do it on your own, and it's not always going to be email after email after email. Sometimes just need to go out of your way. Just how are you doing? How are you approaching this? And I'll give you an example. On the last day of our wrap-up session, I had a very interesting conversation with one of the tutors, Miss Dr. Sabit, and he was just talking about economic evaluations out of nowhere. We had gone for a team building activity and were busy climbing trees and rocks, but then we just kept talking economic evaluation, and so you see that kind of communication. You really can't get it you will not always get it straightforward. So sometimes you have to kind of step out of the ordinary, and so some of these things I was able to pick on courtesy of the training program. So finally, I will just briefly talk about how it has impacted my work. Just as I mentioned earlier, I had just joined ECAS as a research associate, as an economist, and so this training was really a stitch in time. It helped me to take a good grasp of the work we're going to be doing. And shortly after the training got done, we established what we call a service desk. Now, a service desk is really an engagement framework where we have a representative from ECAS, from our institution, and then we partner with another institution. For instance, here in Uganda, we partnered with the Ministry of Energy and Mineral Development through an institution called National Renewable Energy Platform. So the work of the service desk is really to act as an intermediary between the policy-making side and the knowledge brokering side. So as me on this side, so I was appointed to actually take lead on this. So me on this side, I am getting in touch with the contact person on the policy side, on the policymaker side, and so we are kind of talking through what problems are you facing, how can we help you, and so we usually have some meetings and questions come up. And for instance, last Friday we had a meeting and we had to do some question clarification, and this is some of the work that we actually learned in the training program. But also, just talking through and trying to pick their thoughts and say, okay, how can we work with you? How can we help you? What are some of the things that you need, and how can we be able to work together? So just showing you that it's already having an immediate effect on my work, and I'm already doing, but also I'm able to appreciate and effectively contribute to discussions here at work, given our nature of the work that we do here. But sometimes we'll have meetings and we're just trying to talk through maybe a project or kind of new strategy to work, and so I'll be able to listen in and appreciate and also contribute effectively. And I really give this credit to the training program. Expected application at this point, if I'm presented with an opportunity, for instance, to take lead on a rapid review, I know that I have the skills. Of course, you have to work together with a number of people because that is the nature of work, but also I have the ability, I have the skills to be able to take on leadership on this, and also be able to deliver effective outcomes. But also the training is a teaser. It gave me interest. I'm very interested in knowing, okay, what happens after here? No, I'm not in a rush, but I know that when the time comes, I'll be able to take on more learning opportunities as I put into practice some of what I've already learned. So back to you, Firmaye. That is what I had to say, and thank you very much for listening to me. Have a good afternoon.
Thank you, Joel. That was a great summary of your experience, and I like that you put your skills and experience as a buffet, showing the richness of the program and also the informal communications and relationships that you had. Yeah, so saying this, next we'll go to Sifiso for her experience. Over to you, Sifiso.
So good afternoon, everyone. My name is Sifiso Nkwanju. I'm a pre-master's intern from Malawi Liverpool Wellcome program under the policy unit. So I'm also here to share with you my experiences, also my takeaways from the training program. So mine is a journey that started as early as 2019. I'm a trained medical laboratory scientist, and I have worked in the clinical setup. And by the time I decided to make a switch, I was lecturing at one of the institution, Malawi College of Health Sciences, which is one of the big institutions that train mid-level health specialists in Malawi. I realized that during my work in clinical as well as lecturing, there were different gaps. Actually, there were gaps in how our health system is structured. Talk about resource availability, like basic things like gloves, syringes, and all that. And when it comes to looking holistically at the issues of all this, you will realize that it just goes beyond the competences of the institution that you're working on. It covers, it's a broader thing. So it comes from up and then it trickles down to the technical person on the bench. So I wanted to be part of the decision makers. I wanted to be on the table to understand what's going on. Why is it that a district in Nkwanju can't even do a TB test? Why can't we have this? Why is it taking so hard for us to just repair a machine? So I was like, it's either we're not being heard or the ones that are sitting on the table are not doing us justice. So I think that's what that's what compelled me to join health systems. By then, I literally had very little understanding on what health systems or what policy is all about. But I just know that I had a passion in my heart to be part of the decision makers and to influence the face of a diagnostic in Malawi and beyond. So I pivoted, I joined a master's program where I was doing masters in global health implementation at the University of Malawi. And then after being in the program for 2 years, I liked what I was seeing. However, with my biomedical training, as well as the education system it was not easy for me to really practice what I had learned and what I was doing or what were my current career interests. So I started hunting. And then Malawi, MOW happened to be one of the best opportunities to train me. So I joined into this pre-master's training program. The journey has been long, but it's been worth it. However, as soon as I joined, this training opportunity came like I was 2 months in. During this 2 month period, I realized that policy units, it was not only just supporting research, but they also conduct different research. So the heavy workload of our work is research. And I felt lost, to be honest, because I've always shunned research because I felt like it's for the geniuses, the smart ones, it's difficult. I don't know how to do this, I don't know how to do that. And then I found myself right in the space where everything is pretty much research. And when I would go in meetings, I just feel pretty much lost. And everyone seemed to know what they were doing. And my supervisors, she's just this like layers and layers of knowledge and skills. I was impressed, but I was also scared. And this opportunity came right on time. So when I saw it, I was happy. I was like, okay, I'll not always feel down during those meetings. I'll learn something, yay. However, it also I also became curious at this word EIDM. I wanted to understand because from where I'm coming from, when we say evidence-based medicine, we're saying that the clinicians shouldn't make clinical decisions if they don't have results, either radiology results or laboratory results. So I was like, okay, so what evidence are these guys talking about? So I was just intellectually stimulated and curious when I saw the curriculum, but also I felt like I was also hopeful that it's going to be a great opportunity for me to grow. As I am an aspiring health policy analyst, so I feel like, okay, it's going to give me some of the skills that I'm lacking at the moment, but it will also give me the connections and also the exposure that I am looking for in understanding health systems and policy. Next slide. Okay, and then while I was there, I am very grateful. I was able to get what I was hoping for, as well as more. So I'll just share with you some of the skills that I think are vital for now. These are the skills that I think I'm using and I'll continue to use in my line of work. The first one is the first skill I mentioned that my work is a lot of research work. So it was really a great opportunity for me to do research, to understand what research is. From my earlier explanation, I said I used to be afraid of what research work is, but now I can confidently develop a search strategy, and then search for different materials, write a concept, develop a protocol. So I have learned a lot from not scientific writing, but also now doing the nitty-gritties, data synthesis. When you throw a research question, I don't always feel lost like I used to. Yes, I'm not yet there, but I think I am like 50%, 60%, 70% better than where I was like few months before the training. And also one of the things that I have learned, which I'm very proud of, is how to conduct a rapid review. And also this training found us doing a rapid response at work. So it also boosted my confidence in how I approached that work. We wrote a rapid response brief, which was also our supervisor mentioned that is one of the best. It was well written. The skills, the knowledge I borrowed from the training that I was doing at that time. So it's a plus in my line of work. But we were doing a rapid review with the Ministry of Health in Tanzania and universal health coverage issues, particularly health insurance issues. So before that, I feel like my current area field that I have chosen, it will give you like it's like Joel said, it's like a buffet. It's very broad. So it gives you skills where you can navigate literally anything. So if it's education, someone from the education can throw you a question and you will have the skills and the techniques on how to maneuver in that area. Because before that, you would say rapid review. I'll be so blank. You tell me universal health coverage, monitoring and development. I had no idea what these things are. But with the skills as well as the mentorship and the guide that we got, we're able to get somewhere. Our policymaker will also attest to this as he will speak right after we do. So he was also impressed with our work, and I'm looking forward that we will get more as we grow and navigate into the field. The second thing that is very handy is how to do a stakeholder engagement strategy. We are also at our work, we're also in the midst of doing this, and this is when we're doing this module. It was very vital and very relevant as we had projects where we needed to develop our own engagement, stakeholder engagement strategy. And above all, I mean, knowledge can just be knowledge, we can just acquire it, but it's more important when it makes impact, when it reaches the right person, the right individual. So how should we package it? How should we communicate it to who? All this was under communication. So we were not only learning how to write, but also communicate with the individuals to make sure that whatever we have, the scientific evidence is reaching to the end user or the consumer, in this case, the general population. Soft skills, this is my favorite part because you can use these skills everywhere in your relationships at home. So that was the most important part. It was not just learning in class, but also how you can use them in your personal growth and development. So one thing I have learned is relationships, they're not just transitional, but for us to make an impact, we have to understand that at the core of policy work is how to build these relationships. Because sometimes certain things or certain policies or initiatives do not go forward, not because they're not good in and of themselves, but because maybe the relationship is not easy or it's sour. And also to understand, I remember Dr. Runa was the one who carried us through this introduction to evidence informed policy. And then one thing she kept on emphasizing during that class is how the political nuances that surrounds policy making. So for me, it was a great realization that I'm not just going in space of health, but health is not an independent entity. Health plays in a space with different things, including economics, including culture, but above all, including politics. So knowing that if you're into this space, you should also understand how to carry yourself around the political environment that you're in, and to also assess when you walk in a room. She gave an example that I think during one of her, I don't know, project, she worked in with people who, one of them maybe was against a certain idea. So she had to think quick and change her narrative. I was so impressed, but I think it comes with time. And also, but it just teaches you or prepares you that you have to be sharp at how you think, but you also always have to assess the situation. But above all, conflicts are part of life. How should you navigate those conflicts? How should you resolve them so that it does not hinder the work you're doing? Next slide, please. So my takeaways, which I've called impact, or things that I'm going to leave with so many things, to be honest with you. However, I'll just highlight a few. For me, I was able to fully gain to understand, or at least I should say, start to understand. I think that would be fair. Yeah, start to understand what evidence-informed policy is all about, and also to understand health systems and everything involved in that. So it gave me that, and what it isn't as well. Also, like I mentioned earlier, I was not a fan of research work, but it helped me to overcome my fears of research. I realized that my fears were coming in from lack of knowledge and skills, because I was deficient in a certain area. I had not, like expanded myself and given myself the grace to learn. So when that opportunity came and I realized, oh, actually I am able to understand this and that, it actually gave me confidence in how I approach my work. Also, how not only that, but also to generate and to understand what I'm doing, but there's also a part of critically appraising it, and to keep on advocating for ways in which we can push forward for evidence-informed decision-making. It also gave me an opportunity to grow my network, which is very important in my line of work. Right now, we're working with a team in Tanzania. Before that, I wouldn't even think of that. So we've formulated friendships, and we have also formulated important professional networks, which I'll keep on using in different ways, because our cohort was just a blend of different professionals. And it also made me appreciate the role of different people in what we do, in how they will impact health, and in how we should, health is not an independent entity, so we need that multi-sectoral approach when it comes to our work. Moving forward, I feel like it also gave me an opportunity to support my work. Like I mentioned, that there are already activities that we're doing right now. Example, in the next coming week, I'll be finalizing our stakeholder engagement strategy, and I'm getting the skills from my training. And we also have different other projects we need to deliver, like disseminate them, and the confidence and the skills in how to do the technical work is also coming from my training. So for me, it's been a great space learn, like literally learning on the job. So it has made my work easier, and I'm not always feeling left behind. But it has also given me an opportunity to explore other career paths as well as research ideas. Moving forward, I've also come very rooted that I really want to be a health policy analyst because of the work that I was exposed to. I felt like, okay, you know what, this is like a yes. It's like an assurance that, you know what, girl, you're on the right path. So it's given me that. And I would like to also give a shout out to the direct and indirect mentorship, because during my training, I would attend different interviews, and sometimes your supervisor is not always there, your mentor from work, and then you can always call someone from your tutors, and they were there. They were always willing to guide, be like, maybe you should structure this way. So they really helped me and helped me to like structure, you know, my ideas on how I should take my careers moving forward. So I'm super grateful for the informal mentorship opportunities that I've had with different people from different expertise, which has been really a great opportunity. So in conclusion, I found this quote. So our tutor, Dr. Ismail, told me to avoid using quotes in things that I write. So when I was putting this, I was just smiling. I was like, I don't know how he's going to feel about this. But someone from the internet said, policy is nothing without evidence, and evidence is powerless without policy. So it's something, a takeaway. Yeah, I just found it cute. So thank you very much.
Thank you, Sifiso. We know that, you know, you like quotes, and I think it sort of sums up what you explained in your experience. And it's really encouraging to hear from you that, you know, the different challenges that you faced and also the hurdles that you were able to overcome. So saying this, we'll finally go to Dr. Hussein, who's also one of the policymakers in this program. Over to you, Dr. Hussein.
So this is my presentation outline, that is motivation to join the program and the key skills and knowledge gains and the training impact to my work. Next. With regards to the motivation to join the program, we know that health systems are very complex, and probably in low and middle income countries, we work under a very resource scarce environment, and our societies are very diverse. This all calls for the effectiveness in solving the problems, efficiency and resource multi-utilization, and also application of equity lens and accountability in policy formulation and implementation. So this cannot be achieved without the application of the evidence-informed policy making, knowledge and skills, which is a systematic and transparent approach that applies structured and replicable methods in identifying, accessing and appraising the evidence. So with regards to this, and also looking at my roles at the ministry as the head of health system strengthening, this have strongly motivated me to join the program and also continue the need to continue with the next phase of the program, that is intermediate level. Next slide, please. So this is among the these are few among many skills and knowledge that I've gained throughout the 15 weeks of the training program, and systematic review and meta-analysis. The way that this course was delivered while in our postgraduate training, and the way that through this training, systematic review and meta-analysis was presented, it was a very user-friendly, and I could grasp and understand more than previous encounters. Also, the evidence-informed policy-making framework is among other things that the new things that I've gained and learned. and also the concept of knowledge brokering. Thanks very much to Professor Oliver. That also the systematic reviews and evidence summaries are not enough to make good decisions. They need to be complemented with other sources of knowledge, such as formal and tacit knowledge. So the contextual analysis was very interesting part of the sessions that was well communicated by Professor Oliver. Thank you so much, and all the other facilitators. And also the cultural dynamics and contextual considerations, as pointed out earlier, are very key to result in the practical and sound solutions, which are locally accepted and usable. You know, the evidence generated across the globe may not universally be acceptable and usable in all contexts. So it's very good when doing evidence generation and synthesis to have the contextual aspect of the working environment, the place that the policy is going to be implemented. That's very key to inform the adaptability and the formulation of the policy to ease its adaptability and usability. So these are very key messages that I've got throughout the training program. Next slide, please. So with respect to the training impact to my work, it has reshaped my way of describing and analyzing the issues or information I come across with. The health systems is very complex and is dynamic, and we need to be actively engaged with a lot of people in a lot of situations. And this now has improved the performance in system strengthening projects and interventions that we undertake in our level. And also, the training has also improved my effectiveness in such areas, to be very specific. Additionally, the training has also revitalized or stimulated application of this the sense of resources leveraging and equity lens in my daily work. And I'm very confident that the level of achievement will be positively impacted and efficiencies enhanced. And these are among the few that things that will impact to my work as a result of this training. Next slide. Thank you very much.
Okay, thank you very much, Dr. Hussein. That was a great summary of the practical and technical utilization of this program. So now that we've heard from our pioneers, there are a couple of questions that have come in the Q&A, and I would also love to follow up these great presentations with some exploratory questions. So I would go first to Nebiyou. I hope you can hear me. So with your position as a policymaker, it would really be great to hear how this program has improved the collaboration between researchers and policymakers like you. And there, in relation to this, there is a question that came in the Q&A from our audience asking if the evidence synthesis that was developed for the ministry that you're working in has been uptaken, and how your experience of this has been. Over to you, Nebiyou.
Okay, thank you, Firmaye. And also thank you, Fasil, for raising the question and the talk. Regarding the follow-up questions, how the training improved the collaboration between researcher and the policymakers in your context. I believe that on the techniques, procedures, tools, and other related issues on the evidence generation process, the role of researcher is very important. I believe that. So researchers will have a great share on the evidence generation process. Whereas when it comes to policymakers, since they are very closer to the community, they are best fit to identify the real policy issues, the real policy questions. the real community problems. So the policymakers are more of very closer for these questions, for these problem identifications, and to frame these problems. So, not only that, they are also implementers after the evidences have been generated. The policymakers are also the implementers after the evidences has been generated. So I believe that the collaborative effort between the policymaker and the researchers will have a better result to transform the community as well as to change, to bring effective solutions for the problems identified. So it's great to work together as a policymaker with the researchers, in my opinion. So when it comes to the second follow-up question, how the training program changed the way of thinking, my thinking. Previously, we have been working as a researcher as well as a policy in our context. Mostly, we try to generate evidences of different rough assessments. Based on that assessment results, we are going to develop policies or plans or guidelines or whatever projects. But it's not the right path, I think. So it must be professional, and we have to work at least with researchers, not only with researchers, with different partners on the evidence generation processes. So the training changed this of my thought, I think. When it comes to Fasil's question, I think in the question and answer part, how do you, I think the question is a rapid review relevant to MOSA, means the Ministry of Women and Social Affairs, and do you think that it is really answered the question raised by the ministry? So the question, yes, really. The rapid review findings are very critical. I found that it increase to increase women's share and leadership in decision making and leadership positions. So I try to review the final rapid review document. So some of the points are already under implementation in our country, in our ministry office. But some of the rapid review points are untested in Ethiopia, still even untouched. But I found that they are very critical and to be advocated on our future work. For instance, one of the rapid review points states that direct election to reserved seats for women. So there is no any strategy or activity that has been done in Ethiopia before to reserve a seats for women. So it might be a good rapid review point. Another one, women's electoral quotas and electoral system reforms, structural reform recommendation also. There are a lot of pointers I found that to be implemented in Ethiopia to increase women's participation and leadership and decision-making position. So yes, Basil, we found that this rapid reviews very critical, and it will respond to the questions behind the limited number of women's leadership status in Ethiopia. Thank you. Over, Firmaye.
Yes, thank you very much, Nebiyou, for that response. And it's really insightful to see, to hear you explain about our roles as researchers and policymakers, and also to see that the rapid review that is developed has actually really helped respond to the questions. And I can see there might be even follow-up relationships with the question, also outside of the question. So saying this, I would love to thank our audience again for bearing with us, and I'm mindful of time again. And if you have any questions, please again put them in the Q&A and we'll try to respond to them. And so as a follow-up, I would love to go to Shimwe. You're an up-and-coming researcher, and you have an experience in primary research. And it would be interesting to see how this training has shaped your understanding of, evidence-informed decision-making, and if it has done that at all.
Yes, thank you, Firmaye. This training has shaped my understanding, has given me a deeper understanding on how to critically appraise research. And I have seen that there's a really big difference between primary research, either quantitative or qualitative, and rapid response reviews or scoping reviews, you see. And through this training program, I mean, it answered my question, like, okay, you have done the research, you have written the report, you have written the recommendation, then what? You have recommended something for the government or for the stakeholders. Do they really have the time to go look through your 15-page report, and will they understand? You see, but through this training program, I have learned to I have learned the ways to present highly complex information to people who maybe they don't know what research is. And also it has reinforced the importance of how to use relevant evidence to drive impactful and sustainable policies. If you have a policy that is not backed up by evidence, it may not be as sustainable as you would like. And the truth of the matter is there are people out there, there are researchers out there who have done this before, maybe in their context, and you can learn from them. And that is what this training program has helped me. It helped me use evidence, use research from other people, from other contexts, and to see how it can be applied in our setting in Tanzania, basically, because there's no one size fits all approach to things. You cannot use one method to answer one policy question and the same method to use to answer another policy question. That is why you have to use training programs like this equips us to have different techniques and to know different techniques of how to approach these policies or these policy problems. And that is what I have learned from this training program, and that is how it has shaped the way that I work currently, and has shaped the way that I do research now in comparison to how I was doing research in the past. Thank you, Firmaye.
Thank you, Shimwe, for those on-the-spot response. And it's really great to hear that it has affected the scientific communication skill, and it's one of the aims that we do this evidence to policy trainings and generally the skill. So saying this, I would love to come to you, Dr. Hussein. There's also a question in the Q&A that I think would be great to hear from you, where we have our audience asking how you plan to install the knowledge that you have got from this and the communications that you have got from this in the ministry or the office that you're working in. Yeah, it would be great to hear from you if you have anything on that.
Thank you very much, Firmaye. Let me give you an example. In year 2023, we were preparing a certain proposal for health system strengthening in the country, and we did the gap analysis to identify health system challenges and how we can best address those challenges through our proposal. And we had a number of priorities that tripled the ceiling that we had by then. So this necessitated prioritization of the solutions to the challenges, and we set a certain prioritization criteria that was rapidly developed. So having this training actually has reshaped and revitalized my knowledge and skills, and on how best now I can prioritize issues when it comes to a resource scarce environment that can be addressed during particular time using the evidence that has been generated throughout the globe and the country as well. So partly in making informed decisions on how to prioritize certain interventions over the others, as guided by the systematic and the transparent approach that will guide that decision to prioritization. So that is number one. And number two, we do implement complex projects in our setting. And project implementation needs continuous monitoring and consequently evaluation. And there are different types of monitoring, that is compliance monitoring and performance monitoring, etc. All these now need to be informed with specific indicators tagged to or with specific indicators that will be also informed with specific data sources. All these indicators and the data sources must be obtained and generated using an informed approach, that the selection of appropriate indicators in the data sources that will effectively and efficiently monitor the implementation of the projects. All these are the results of this knowledge package of evidence-informed decision or policy making training. So this is among the few among many examples that I'm going to practically apply in my work settings. Thank you, and over to you, Shimwe.
Hussein, for that and for providing us a real life experience of how you've applied this experience from end to end, really. And this is really encouraging to bring in more policymakers in the future as well. So saying this, we have a couple of questions that I believe would go to Dr. Ismail. But before I do that, I would love to hear first from Joel, then Sifiso. Maybe if you can give us your top 2 advices to future participants that would come into this E2P training program. Joel?
Yes, for sure. Thank you, Shimwe, and everybody for the wonderful discussion so far. One, I would really tell whoever is coming in that keep an open mind. You just do not know which policymaker you'll meet and which field they're from. So you have to be willing to learn, relearn, and unlearn. Also, I've come to realize that some of the material is skewed to the health sector, because I understand that evidence-informed decision making recently developed primarily from the health sector. So really, you've got to be able to understand, accept to learn the particular field, and then relate the knowledge you've learned into wherever you want to go. But then also the second thing is I will tell you, practice and practice some more, because the knowledge and skills you get, I mean, knowledge is essential, but skills are what set you apart. Because, the practical session is what sets you apart. You've got to look for opportunities to implement whatever little you've learned, whether you've learned how to make a search strategy, go and try a search strategy. If you've learned how to, do a simple search on Cohort, go and run a search on Cohort. And I can tell you for sure that is where the money is. That really works. And I picked it up during the course, and it has helped me this far. And also towards the end, actually in the last sessions, Dr. Rona really emphasized that, look for opportunities. If someone is doing something, what are you doing? How can I work with you? Depending on your availability as well. So yeah, really, that is it. Over to you, Firmaye. Thank you.
Thank you very much, Joel. Sifiso?
Okay, thank you, Firmaye. For me, my takeaway, and also what I would tell everyone who is interested in learning this, for starters, I vouch for it. It's a good learning opportunity to understand if you're in the field of policy making, EID and all that. I think it gives you a good footing and also a good foundation. Moving forward, I agree with what Joel was saying. I think interest is very important. So just be willing to learn from pretty much everyone. I think if my cohort could say one thing about me, I was always willing to say I don't understand, and I still do it. If you don't understand, say it. You not learn anything if you try to hide or be something you're not. So be who you are, be authentic, and always have the heart to learn from pretty much everyone. And the other thing, I think, for one to thrive are the relationships that we're going to build here. So I feel like the field is very broad, and you have to depend on other people and other skills. So the relationships that are going to be thrown in your face along the way, I think take them and use them wisely, because they will determine between becoming excellent at what you do and also how far you can go. There are days where we just feel a burnout because everything just feels overwhelming and there's a lot of information, and you don't know where to go or what to do, but you just give a call to someone. For example, in my case, I'll call Carol, because I've interacted with Carol in the group, and then she'll just have an immediate response at the same time, and I'm like, oh, okay, so I was supposed to go in this way. So I feel like it's important to cultivate the professional relationships that we have found, and also even in our line of work, the relationships that we're going to build, because I feel like this work really hinges on the quality of our social capital. So invest in the social capital, invest in the networking activities. I think they will take us far. So yeah, thank you.
Thank you. Thank you very much, Sifiso. And it is really great to hear your reflection and the experience, the open-mindedness and the practicality of this program. And it has been really great to hear from all of our panelists of their experience. And since this is something that is going to be continuing in the future as well, it's really great to hear that we have a very high note on the training. So before we go into finalization, there are two questions that have come up, program-related questions. So Dr. Ismail, I'll come to you. So the first question is if asking if ACRES has any mechanism for evaluating the impact of the training. And secondly, this question is actually looking forward, which is really encouraging. And it's asking if you have enrolled people in the next level so far. And if it is, at this stage, you can speak on that. Then we'll go into the closing remarks. Over to you, Dr. Ismail.
Thank you, Firmaye. I have attempted to respond to those two questions, but I'll highlight the responses again. About the mechanism for evaluation, yes, we do have a mechanism to evaluate the trainees, and this is going to be on a progressive basis from what we had immediately, but also along the way, and also related to the products that they have, as you've all heard about the relationships that they're building. We're also putting in place mechanisms for them to continue collaborating and building the relationship within the cohort. Hopefully, they'll be able to join us sooner at the mid-level and the advanced levels. So as Joel had mentioned, fingers crossed, we would be able to see them, but we do definitely have mechanisms for that. And thankfully, right now they are all part of they're working with the different partners that we have. Hopefully it remains that, but even if it doesn't, we will follow up with them. About the mid-level, yes, we have enrolled. At the moment, we have 16 trainees, 8 researchers, and 8 policymakers as intended. We are pairing researchers with policymakers. At mid-level, the researchers were paired with policymakers in a group. So one policymaker to a group of researchers related to a specific policy issue within the country or the department the policymaker is coming from. This time around, it's going to be a one-to-one pair. So we look forward to how that goes. Thank you.
Thank you very much, Dr. Ismail. So before you go, I would love to hear from you if you have any final thoughts or key takeaways, or if you have any future plans that you want to share around E2P program before we close.
I think our panelists have shared quite a lot when it comes to what would have been my final thoughts. But I would say if we're looking at building or scaling skills or competences in knowledge brokering, this program is one of the ways that we're hoping we'll be able to show best practices in training. We will be working very closely with our facilitators, and thankfully one of them is here with us, Professor Sandy Oliver from University College London, as had been mentioned, and other brilliant facilitators who we are fortunate and for her to have joined us and believed in this project, and believed in those who would want to be trained to be better knowledge brokers. We are working to get ISO certification, and this should enhance the credibility of the program, but also the quality of the processes that we've put in for the trainees to be able to gain the competences. So we look forward to you all or to recommend those who you would think would benefit from this. Next up, we will have the mid-level training that should start on 1st April, and the advanced level training, which will also be combined with the leadership training program, will also start shortly thereafter. Yeah. Thank you.
Okay. Thank you very much, Dr. Ismail. And so we are coming to the end of the webinar. So with this, I would love to thank all of our panelists, our participants in the audience, and also the organizers of this program and the webinar as well. And if you have any follow-up questions, please reach out to the organizers of this webinar, and we'll try to get back to you. And so thank you very much and have a good day.
Subiri niage usikate. Thank you. Thank you, Firmaye. Bye-bye.
Thank you.
Thank you, Firmaye.
All right, bye-bye.
Bye-bye.
Thank you, everybody. Thank you so much.
Bye-bye.